Hey, what's up, everybody? It's Dr. Jason Jones back with another episode of Health Made Easy. And on this episode, we're going to be talking about something that is super relevant to pretty much every person who is going to listen to this podcast. And that is your back pain caused by a spinal disc issue? Now, the reason that's relevant is because back pain certainly can be the result of a spinal disc issue. But it's estimated that about 80% of people in the world at one point in their life, is going to experience back pain. It can not only be very painful when that happens, but it can restrict movement of the low back and eventually of the rest of the spine. People with back pain may find it very difficult to bend or to lift objects. Several factors can cause back pain, of which the spinal disc is one of them. Research has shown that spinal disc pain is prevalent among people with lower back pain in about 40% of reported cases. The spinal, or what's also called as the intervertebral disc, is often referred to as a pain generator by medical experts. Now, a pain generator are those places in the human body where there's some sort of abnormal physiological thing happening that can actually trigger pain. Now, there are differences between the intervertebral disc and how it may actually cause back pain. And we're going to talk about two of them today. One is a disc injury, which makes sense because as a result of a disc injury, due to a tear in what's called the annular part of the disc, which is the outside, or a herniated disc problem. Pain in the lower back may be experienced when that happens. A herniated disc is said to occur when is a result of either a bulging disc or some sort of breaking of the outer part, and then that soft jelly-like substance in the inside starts to come out. And when that jelly-like substance, also known as the nucleus pulposus, don't worry about remembering that, breaks out and comes into contact with any of the spinal nerve roots, they tend to feel pain, especially in the lower back region, but that can happen at anywhere along the spine. And I would say that an important thing to do is if you're having any sort of back pain or if you feel like there might be some sort of disc issue, definitely seek out some non-surgical treatment first. We're going to talk about that later on some other podcasts. But this may occur when you're lifting a heavy object, or you're maybe using a rounded spine, or you're bending at the waist and then rotating at the same time, which is the most common cause of a disc injury, is in being in that position. And what this means is that when you try to lift the object without bending your knees, it may result in a disc herniation leading to the back pain. So a spinal disc injury leading to back pain can occur even in young adults, as young as, anywhere between 18 to 35, when the disc water content is still really, really high. Now, the second thing is a disc disruption. Now, according to studies, disc disruption is another type of abnormal physiological activity that may lead to back pain. It is also referred to as internal disc disruption, or IDD. It's different from degenerative disc disease. Degenerative disc disease occurs due to wear and tear over time, while internal disc disruption is a result of internal changes to the disc that when it's trying to regenerate itself, like the jelly-like substance in the middle or in the center of the disc. So things like forward and backward movement, also known as flexion and extension, that's basically bending at the waist or bending backwards. Those are internal changes to the spinal disc, that can cause and lead to back pain in certain studies. So one of the things to think about when you're looking at studies or reading a study is, what are the methods, what are the mechanisms, what are the things that they're actually testing, and oftentimes when it comes to what they're doing and then how that relates to clinical practice, oftentimes there's a bit missing because researchers are not clinicians, and they just are not seeing it. They're not in the trenches every day seeing the things that they see. So the treatment of back pain associated with spinal disc problems, to treat those things, I would say Chiropractors use a very simple, hands-on techniques like spinal adjustments. They do things like spinal reconditioning and strengthening exercises. Certainly can be recommended as part of a recovery from back pain. Back pain caused by spinal disc issues certainly can be treated by a very competent chiropractor. But regardless of who you're seeing, you do need to have a physical exam done. You most likely are going to have some sort of imaging done. And I think that's very important. Testing and specialized testing may also be included as well. And you want to have those things done so that you can narrow down what's actually causing it. Because oftentimes, whether it's back pain or almost any other condition, regardless of what it is, we end up treating symptoms more than we do actually treating the cause of the problem. Because when you treat the cause of the problem and you can actually resolve the cause of the problem, more often than not, the symptoms will just resolve themselves as a result of that. So that's something, and I think in healthcare in general, we just need to get back to treating the cause, not just treating the symptoms. Hey, this is Dr. Jason Jones. I hope this was super helpful for you. We'll see you guys on the next podcast. Have a healthy week. Bye-bye.